Alright guys, so we're continuing with the low back and the hip. Again, lack of motion in the hip leads to extra stress onto the low back. If you're going through these videos and you're having some issues with them, don't hesitate to give us a call or stop by the office. We'd be more than happy to walk you through these so you have an understanding about what to do. Again, our goal about doing this is that 80% or 90% of conditions can be managed by you. So we want to give you that power, something a little unique. So what we're going to focus on today is we're going to go into external hip, external hip motion and improving that. Again, when we sit for prolonged periods of time, we're causing that hip to get locked up. It's not moving the way it should, and that's going to lead to having to go get motion somewhere else, either into the knee, which we'll cover in other videos, or into the low back. So actually, let's go ahead and we'll show you. We're going to do external capsule first, and then we'll show you how you guys can mimic this at home, okay? So all fours, okay? Kind of walk through it a little slower for me, Ash. So start with all fours. This is something easy for you to do. So she just perched down on all fours. Go ahead now, next step. Okay, she's just going to bring that left leg back, and then she's going to just kind of tuck that. Again, she brings that hip, the right leg, she brings the knee to the midline, right into her center chest, and then all she did was sweep this back leg. Yep, all she did was swing it across, and she brings it down and sets the knee down. Okay, now the next step, which is pretty important, is now she's going to bring her chest down to the ground. And as she does that, what she's going to be doing is she's actually going to be pushing this hip kind of back into this hip capsule. And that, again, it's going to help create some more of that free range back here, because what are we doing when we sit for prolonged periods of time? We're reducing this, okay? So you're not getting enough motion. So as she comes in here, she's starting to push this hip back into the backside of the glute, and that's what's going to allow her for some more motion. Now, one other thing she can add to this is she can actually bring her chest and kind of move her chest from one side to the other. So if she wants to, she can actually come over this way, and all she's doing is playing in that hip motion back there and just trying to, again, create as much range of motion into the backside of the hip, where what we're doing is we end up spending too much time sitting. So stop the sitting and start to get the stretching. So we'll come back to you with some more. Again, feel free to give us a call. If you need us, we're always here for you.